Hello, I'm Robbie.
I'm Louie.
And I'm Owen. Are you sitting comfortably, boys and girls?
Yes! Now we shall begin.
Our topic is public health in the Renaissance England.
After the Black Death of 1348, plague never completely disappeared. Leicester, for example, suffered 10 outbreaks of the plague between 1550s and the 1640s. In 1604, 30% of people of York died from the plague. Outbreaks like this happened all over the country.
One major reason was that towns were still overcrowded and full of dirt. The government did issue some orders, just as stating that bundles of straw had to be hung as a warning outside the homes of plague victims, and that people who came from infected houses should carry a white stick in public. However, little was done to enforce regulations because of the cost of employing people to do this at the time, when there was no police force.
In 1665, another outbreak of plague killed around 100,000 people in London, a quarter of the city's population, and many thousands more all over Britain. A general mortality bill for the year 1665, listing the number of deaths in each parish and the overall different causes of death. The kind of evidence demonstrated how the plague hit the crowded, poorest parishes hardest.
Doctors had no cures for the plague. Many physicians followed their wealthy clients out of London. Some stayed, including Dr. George Thompson, who carried out an autopsy on a plague victim, hoping to learn more. Thompson caught the plague but survived. Perhaps his own remedy, putting a dried toad on his chest, worked.
Methods of preventing the plague were, however, more carefully thought out and organised. The Mayor of London ordered that victims be shut in their homes and watchmen stood guard to stop anyone going in or out. When anyone died, the body was examined by women searchers to check the plague was the cause. The findings were confirmed by surgeons. Bedding had to be hung in the smoke of fires before it was used again.
In 1966, London was destroyed by fire and was completely rebuilt to the designs of the architect Christopher Wren. In place of the narrow, dirty streets and wooden buildings were stone and brick buildings with wide, better paved streets. For a time, London was healthier, but as the city became more and more crowded again, the benefits of the rebuilding began to fade. All of this would have a great impact on public health in England.
Thank you.